Tens of thousands of women are diagnosed with gynecological cancers each year, but now new tools and technology are leading to better outcomes and a better quality of life. Joining us now to discuss is Dr. Shelly Seward with the Orlando Health Cancer Institute. Thanks so much for being here today.
Thanks for having me.
Are women doing a better job of getting the checkups that they need to make sure that they're healthy?
Well, what happens is women see their OB-GYN regularly when they're younger, and as they get older, they think, I don't need that anymore, right? I'm done having babies, I'm done with that. But the recommendations are that you actually get an annual GYN exam every year. That doesn't necessarily mean you need a pelvic exam, but you should see your GYN provider, talk to them about what your needs might be, what symptoms you're having, so that you can move forward with what kind of screening you do or do not need.
Right, and that's really important because the only way you can get that information is through going to a doctor to get your pap smear, to have them do a physical examination. So we're making progress, but we're not quite where we need to be yet.
Correct. And for stopping cervical cancer, we have the HPV vaccines that are readily available now. Unfortunately, I don't see that patient population because I see adults. It's those pediatric patients, boys and girls between the ages of 9 and 11, that should get HPV vaccinated to help prevent any of those cancers that are caused by HPV.
If it happens that you have cancer, though, there are a lot of new exciting tools and treatments that are helping you give patients better outcomes. And one of those is something called green cyamine dye. Tell us what that is.
Correct. So it's indocyanine green, also known as ICG, because that's a mouthful. What we know is that when we are looking at cancers, whether we're looking at GYN cancers, breast cancer, or colon cancer, one of the things that's going to give us a prognosis and tell us whether you're high risk for this coming back and need adjuvant or additional chemo or radiation is the stage, how far the cancer's gone from the site it starts. One of the big places that cancer spread to are your lymph nodes. So if you've ever had a sore throat and you have those swollen glands those are lymph nodes, but they're everywhere. Unfortunately, cancer can hijack that pathway or kind of take it over. Now, sometimes those cancer cells that are spread to the lymph nodes are so small we can't see it on a CAT scan or a PET scan. So now we can inject certain areas around the tumor or into the cervix with that ICG green dye. That ICG green dye will be taken up to exactly where that tumor area is being drained to, so we can find the specific high-risk lymph nodes instead of just randomly taking them all.
So you're not going in there with a wrecking ball, it's very selective, and then you're improving the outcome of the treatment, and you're also reducing the impacts from any long-term effects from whatever treatment they have to receive. It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/cancer.